table over here with Joan and Andrea. Just
Hi,
tell me what number you guys.
All right, I'm sorry, we're number 3.
Number 3, okay.
Do you want me to just, I'll
Yeah,
just
read
go
it out
over
loud
real
for
quick.
everybody. And then
Okay, so Linda's a med-surg nurse, is a nurse on the med-surg floor and is known to be a great resource for students and new hires. The orientee, Colleen, asked Linda to show 2 other orientees the process for safe patient handling. Okay, since Linda's not familiar with the other unique learning styles of the 2 additional hires, how can she teach this skill in a way that appeals to each learning style? So kind of cheating, but obviously they could use Mosby skills. And then personally, I like to do a cheat sheet up for like things that are like frequently asked questions, and then ask for a demonstration of the skill, because the person that feels most comfortable demonstrating it will be the person to volunteer to do that, because they'll know that that will reinforce their learning. And then discuss the skill at the end for like those that need auditory learning.
Great, so you're going to demonstrate it.
For hands-on people like me.
Exactly.
And then, like I said, discussing it afterwards, so that it reinforces it for the auditory learner.
Perfect. And maybe hand out illustrations or diagrams for your visual learner. Cool.
Yeah, the cheat sheet that
Yeah, the
she
cheat
will
sheet.
create.
Perfect. Very good. Yep. All right, cool. You guys?
We have number 4.
Okay.
Patrick is a second-degree nursing school graduate who's been assigned to be his preceptor. In your first meeting with Patrick, you asked him about his interest, goals, and expectations. During the meeting, you also want to determine his preferred learning style. What are some of the ways you could uncover his learning style?
But basically, aside from just asking him how he prefers to learn, it seems like Patrick had a second degree, so probably already has some learned skill sets from other jobs in the past. Maybe asking him how his experiences in the past have gone, how he's best learned certain skills, and then try to duplicate that in this current experience. And you could also test certain styles out visually or tactile, and then see which one he seems to take a liking to or improve.
Exactly. So all 3 of those things would be good. Another thing is to have him teach you something, because the research shows that people kind of tend to teach in their preferred learning style. So you can just ask him, even something simple like, "Oh, show me how you would do that," or teach me this and see what he does. It's not 100%, but it's definitely a good indicator. You can also give him, a copy of this test, which we can give you guys copies of if you wanted to. And if ever in doubt, if you're working with somebody, maybe you're just asked to precept somebody, just for one day because their designated preceptor's off, you can just incorporate all 3, and then you're going to be sure to kind of hit their preference as well. Thank you, guys. All right. Bethany's still.
Grade number 7.
Okay.
As Bob's preceptor, you notice that he tends to move his lips while reading instructions, asks multiple questions throughout the day, and talks about the care he plans to provide before performing. You tend to process information better by quietly reflecting, reading, and writing things out. Should you request that Bob be reassigned to new preceptor? If not, how would you field his learning preference when teaching him about drawing a blood specimen and labeling it properly? So, we decided this, just because we have different teaching styles doesn't mean you need to be reassigned. And that a good way to teach him how to draw a blood specimen, I suggested having him look up the policy, print it out, read it, and then say, walk me through it. And that way they could talk it out, and they hear their own explanation, and read it.
Perfect. Yeah, so the key is you don't, like as you said, you don't need to have the same style. You just kind of have to appreciate that everybody's different and that people might have different styles. So if it's a little uncomfortable for you to, step outside of your style and teach to somebody else's, again, you can do both. It's not going to offend him to ask him to read it, but just be sure that you give him the opportunity to discuss it and ask questions as well. All right. Next.
Number 6. Stephanie comes to you and asks for guidance as she knows that you are an experienced preceptor. Stephanie sees that Casey, her RNT, seems to zone around when she is talking to her about a new skill and is always moving around, clicking her pen and can't seem to sit still during staff instructions. What kind of learning style do you think Casey prefers? What can Stephanie do to try to appeal to this learning style? Give an example of how you may teach her skills such as checking a blood glucose with a collar. So it sounds like she's a tactile learner, so you can probably show her how to use a glucometer and how to check out blood sugar with it instead of like talking to her or just showing her pictures.
Right, a simple low risk thing would just be to have her do like the control test. That way she's walking through each step with without, going into a patient, asking you all the questions in front of them and the person looking like, she really know what she's doing. Let's see.
We have number 5. It is 2 weeks after taking this preceptor course and you are speaking with Joanne. Joanne has been assigned an orientee to work with, however, was unable to attend the preceptor course. The nurse educator asked Joanne to complete the learning style inventory tool. Joanne comments to you, I've been doing this job for 15 years. I don't know why I need to spend time taking this test. I am not the one being trained. How would you respond to Joanne? Just say you might have a different learning technique than the orientee and you need to be aware of what yours is. Kind of adapt to the orientee, recognizing you have 15 years of experience and,
Exactly, so we're not testing her, and actually you can let her know that it's gonna benefit her in the long term, because as a nurse, she is gonna be continually learning as well. If any of us are gonna make it in the hospital, we have to, keep learning, so just for her to know her own style, number one, her level of satisfaction with her orientee is gonna be better, but it's gonna make her learning easier, so when she's, meeting with her nurse educator, or even speaking with her peers, trying to learn new information, she can ask for it in a way that's gonna be, appealing to her and, help her to understand information a little bit better. And just again, you're gonna remind her that it's not about matching up with the same style, but rather just sitting down with the orientee or, just watching and listening to what they have to say to let their preceptee, know that they do really care about them and they're interested in what they want to learn, which brings us back to adult learning theory. Okay? All right. So a couple of those closing points, again, being aware of yours is the most important. Also, it's just going to help your relationship with your preceptee. They're going to appreciate that you took the time to incorporate them and that you're not just lecturing to them, that you're trying to help them truly understand the information. And sometimes it is okay to incorporate all 3, and there are actually skills that are going to require that. So don't be afraid to, have somebody do something just because they don't prefer it, because the truth is you can talk to them and have them read about setting up an IV pump until they actually get their hands on it. We need to make sure that they're competent in that as well. All right, and that, just being aware of your own learning style is going to come in handy for you as you continue to learn too. All right, take care, guys. Good luck. Any questions, anybody?